Matt Del Vecchio here. As our population ages, conversations and difficult conversations about later stages of life become more common. There's a growing popularity for people to choose medical assistance in dying. In fact, in my line of work, I get asked a lot about medical assistance in dying, or what is commonly referred to as MAID. What used to be a taboo subject is becoming more and more popular. Well, I'd like to bring in Dr. Benjamin Schiff to learn more about MAID. Dr. Schiff is an MD and assistant professor at McGill University in the Department of Family Medicine. He has been a MAID Assessor and Provider since 2016, one of the pioneers, and is a member of the MAID Resource Group College of Family Physicians of Canada. He was a member of the Canadian MAID Curriculum Development Committee and continues to provide teaching about MAID. Dr. Schiff is a full-time family physician working at St. Mary's Hospital right here in Montreal, and most of his time is spent as a hospitalist, including working in oncology. He has a lifelong interest in medical ethics, especially around end-of-life care. Dr. Schiff, welcome to Life Unrehearsed.
Thank you very much for having me back, Matt. Appreciate it.
Great to have you back on the show, Dr. Schiff. It is still a hot-button topic, medical assistance in dying. So for our listeners, can you define MAID for us?
So essentially, it's when a competent individual, 18 years or older, who as a result of his or her or their particular circumstance is experiencing some form of unbearable suffering, could be physical, psychological, or both, and essentially voluntarily asks a physician, or now in Quebec as well, a nurse practitioner, to help end that suffering by asking to die.
All right. And clear definition there, and always a sensitive topic, but like I mentioned at the outset, getting popular. So can you provide us, talk about popularity, what are some of the latest statistics, Dr. Schiff, about the number of Canadians choosing MAID?
So as of 2023, there were about 15,000 people across Canada that chose MAID, and in Quebec it was about 5,200, give or take, which represents almost 7% of the population, and has been increasing ever since it came in. So 7%, about 6.5, give or take, it's changing a little bit. The percent of the population who passed away in Quebec have done so using MAID.
All right, almost 7% of those who have died in Quebec choosing MAID. Quebec being one of, if not the, I guess, most accepting of MAID. And can you please describe, Dr. Schiff, about what conditions need to be in place to qualify for medical assistance in dying?
So you have to be a resident of Canada or Quebec. You have to be 18 years or older. You have to be competent, as understood by the law and by physicians. And you have to have what's called a grievous and irremediable condition, which essentially means you have to have a serious illness, disease, or disability, which is incurable. You have to be in an advanced state of irreversible decline, however that's defined. And you have to be suffering in a way that cannot be relieved in a way that you feel is acceptable to you. So you have to be sick with a disease or disability that won't get better. You have to be declining in an advanced state of this decline. And you have to define it. The most important thing to keep in mind is that suffering is not defined by the physician or the nurse or the social worker or the father or the sister. It's defined by the person themselves. They're the ones that are able to express to the physician and practitioner and the team how it is what their suffering consists of. And that's the most important part of all this. It's about that person getting to choose and define that suffering for themselves.
Right, absolutely. The most important part. You're cutting a little in and out on the line here, Dr. Schiff.
Sorry.
But okay, so you clearly describe the conditions. You need to do this on your terms. What, at the end of the day, is what it's all about. Now, you've participated in the actual MAID process. So can you describe what the event actually looks like, if you can capture a little bit of the perspective from the person receiving MAID and perhaps just as importantly, the family members around as well?
Sure. I think the most important thing to remember is that the person themselves chooses the time, the place, the circumstance, and has the opportunity for whoever wants to be there, because it's your choice and the person's choice and the family member's choice, of course, but who wants to be there to share in those final moments. It also gives the person a chance to prepare, because when they've chosen a particular time and place and date, then the family and friends have a chance to celebrate their life, be with them, and make sure that they're there before it happens. The actual moment can vary from person to person. One of the last ones that I was involved in the hospital, there were actually 20 people in a room. We moved this person into actually a family room. It was a woman in her 60s who was suffering from lung cancer. Her husband was in the bed with her. Her son and daughter were with her on the bed, talking to her. There were many people around. There was tears. There was relief. There was laughter. And it's not actually at one point as we were coming close to the end, this person's daughter sort of looked at my watch and said, "Oh my God, it's 11:07. That's the birth dates of myself and my brother, and it would be very meaningful to the family." So clearly the emotions are there, but I've come in rooms and they've been telling jokes to each other and celebrating each other, and often it gives a chance for the person who's passing away at the very end to be able to share some final thoughts that they want with their family, to live in peace, to live well, to live like lions, so many different things. But that moment to be able to share at the end, time and a place that's organized, that's set, without the hustle and bustle that can often happen, whether it's home or in a hospital, a peaceful time, a time really when you walk in the room, you don't sense that tension. You just sense a sense of calm and relaxation, particularly from the individual who's had a chance to be able to make that request and have that request honored.
Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking about medical assistance in dying with Dr. Benjamin Schiff, a MAID Assessor and Provider. A very nice description. You automatically assume, boy, oh boy, this must be sad and a very difficult environment, and I've talked to quite a few people that have had it done, and as you're describing, it is a roller coaster of emotions, and yet there is also that sense of relief, right? Like you're describing, and the person has chosen on their terms, and I think for some people that's how most people want to go, right, Dr. Schiff? It's on your terms.
Well, that's it. And of course, most people don't get that chance. They don't get a chance necessarily to say goodbye or have those moments alone, or those moments to share and to express with their family and with their friends. And yes, of course, there's crying. Of course, there's tears, and of course, there's sadness. But again, there's a sense of community, a sense of family when everybody's there. And I can tell you, as myself walking in that room, there really is this sense of serenity and peace, that everyone's come to terms with what's going to happen. And obviously, it's hard to say goodbye to somebody that you love, but I think it also helps that they understand that this person is going the way they want to go, and is going to be leaving their suffering behind, which is what most of us would want for the people we care about, is not to see them suffer. And this is the sort of the way that we make sure that there's no more suffering. And I think ultimately that's what helps people accept that. Even, of course, it's difficult. No one ever wants to see someone they care about die, but they also don't want to see them suffering.
Talking with Dr. Benjamin Schiff, a MAID Assessor and Provider, about medical assistance in dying. Dr. Schiff, I'm going to ask an unfair question because you need to answer it in less than a minute. But the federal government recently has delayed the expansion of the medically assisted death law to cover those suffering solely from a mental illness. So what are your quick thoughts on that?
Well, my quick thoughts are that I understand why it's difficult, because by definition, if you're suffering from mental illness, then you're likely or maybe having difficulty sorting things out and making what some are called rational or reasoned decisions. And even though we know that somebody who's asking for MAID is actually asking to die, and by definition we may say that they have a suicidal wish, that's done in a way that we think is a reflection of their processes where they've had a chance to reflect and think and rationalize, if you will, about what's happening to them. Whereas if you're suffering from mental illness, that illness itself may make it difficult for you to process and think clearly in those terms. On the other hand, you may also be suffering. So I think the challenge is going to be going forward, developing a process where you can help differentiate between somebody who is suicidal because they're oppressed and don't understand and their brain chemistry is impacting them, versus somebody who's suffering long-term with a depression that won't get better and has made a, again, rational and clearly thought-out decision about wanting to die. And that's the challenge going forward. And I think we will get there one day, but that's the challenge right now.
And I think a lot of our population wants that to get resolved. Such a sensitive topic. It will continue to be on the forefront of people's minds. And like you say, there will eventually be some type of resolution and solution to this. Dr. Schiff, I want to thank you very much for taking a little time here on a Sunday on Life Unrehearsed.
My pleasure. Take care now.
Thank you very much. That's Dr. Benjamin Schiff. He's a family physician working at St. Mary's Hospital, and he's been a MAID Assessor and Provider since 2016.